Good afternoon. I'm Bailey Warfield. The governors of Minnesota and Wisconsin are providing updates on their state's battles against COVID-19. Governor Tim Walz will speak in a half hour, but first, let's go live to Governor Tony Evers speaking in Madison.
Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestun, the Chief Legal Counsel for the Governor's Office. We will begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thank you for joining us today. I'd like to begin, as always, by thanking all of you for doing your part to prevent the spread of COVID-19. I've said it before, say it again, we've got to work together to flatten the curve and to stop the spread of this virus. Wisconsinites are tough, we're resilient, we help each other in times of need. And folks, we're going to continue to need your help. The number of Wisconsinites infected with COVID-19 is expected to continue to increase in the coming weeks. This increase in cases is also expected to bring a surge of patients who need to be treated by hospitals and healthcare clinics. Wisconsin's dedicated healthcare professionals have been working tirelessly on the front lines of this pandemic for more than a month now. But the surge will be with acute cases that is projected to hit our healthcare systems, and it's going to require more of us to step up in support of these ongoing efforts related to the COVID-19 crisis. Our top priority is to make sure there are enough resources to care for the growing number of people who require hospitalization or other healthcare interventions because of this pandemic. That's why I encourage you to help our healthcare systems in this coming time of need by signing up to volunteer through the Wisconsin Emergency Assistance Volunteer Registry. Through this registry, we are creating a wide network of volunteers to increase capacity at hospitals and clinics across Wisconsin. Help is needed in both clinical and non-clinical support roles. However, we especially need licensed professionals to volunteer for critical clinical roles. These include physicians, physician assistants, nurses, nurse practitioners, certified nursing assistants, social workers, pharmacists, pharmacy technicians, physical therapists, physical therapy assistants, respiratory therapists, and behavioral health professionals. Our effort to build this volunteer network is one of the many proactive measures that we are taking to plan for that surge of acute cases that are projected to hit our healthcare systems in the coming weeks. We've already made a number of changes to help grow and strengthen our healthcare workforce, such as expanding telehealth services, making it easier for retired healthcare workers to rejoin the workforce, and allowing out-of-state healthcare professionals to practice in Wisconsin. These efforts have helped, but as we prepare for a surge of cases in the coming weeks, we still need more folks to help. Volunteers will play a critical role in ensuring that we have the resources and flexibility to respond to our state and local needs. I urge you, if you can, please sign up to volunteer for these critical roles. In addition to needing additional capacity in our healthcare workforce, we're going to need additional space to treat folks as the number of acute cases continues to rise. Our team at the State Emergency Operations Center has been hard at work over the past few weeks to prepare for this surge. Yesterday, I announced that the Army Corps of Engineers has officially been engaged and has already begun mobilizing at the Exposition Center at the Wisconsin State Fair Park to begin development of an alternative care facility, or ACF. We are extremely appreciative of FEMA and the Army Corps of Engineers for their responsiveness as we continue to see an increase in the number of individuals testing positive for COVID-19 in Wisconsin. This alternative care facility will be a critical addition to the southeastern part of our state and will be essential to continuing to ensure our healthcare systems are not overwhelmed. I also want to thank and give my sincere gratitude to the Wisconsin State Fair Park leadership. Their willingness to open their doors to support the region's residents during what may be these folks' darkest hours is exactly the kind of leadership that illustrates how Wisconsin's best are stepping up and in response to COVID-19. Another way that we're being proactive is around contact tracing. Once someone has confirmed COVID-19 diagnosis, it is extremely important to find out where they have been, who they have been in contact with, so that we can try to further contain the spread of the virus. Over the course of the last few weeks, DHS has added more than 120 contact tracers to aid local public health departments who need additional capacity. Contact tracing staff have worked to follow up on more than 1,000 interviews to identify and notify contacts for the Milwaukee Health Department alone. Additionally, the legislative package that I propose and that I have been urging the legislature to take up as soon as possible includes $17 million in new funds for local public health agencies and 64 additional staff at DHS to adequately respond to our public health needs in Wisconsin. These proposed contact tracing assets will be critical to Wisconsin's ability to actively manage this pandemic until effective medical treatment or a vaccine is available. DHS is also working with local health departments across Wisconsin to effectively track individuals who may have been exposed to COVID-19 during Tuesday's election. I was impressed by the efforts taken by local clerks, poll workers, and our National Guard members and the voters themselves to keep each other as safe as possible, but we must be prepared. Part of that preparation is increased capacity in contact tracing, making it possible for anyone who tests positive to be interviewed about their contacts, and then notify any individuals who may have been exposed to COVID-19. Because people who may have contracted COVID-19 this week may not begin to show symptoms for a week or more. It will be incredibly important for us to continue to closely monitor and trace contacts for these cases. It just goes to show that COVID-19 public health emergency really has affected all of us in so many ways. We are holding staff meetings in the living room and geometry class at the dining room table. We can't go out to get a haircut and we're feeling cooped up at home. COVID-19 is changing where and how we do things, almost everything, and we all have had to adapt quickly. So before I hand this over to Secretary Palm, I want to say thank you so much again to all of our critical workers who are on the front lines working to provide health care, keep our grocery stores open, clean and stocked, farm our lands, and ensure our infrastructure is maintained. In this time of safer at home, it is extremely important that we continue to respect all our residents and workers of this state, no matter who you are, where you live, or what you believe. Kindness and understanding is how we will get through this. The last thing we need right now is stigmatizing or calling out any group of people, and especially those who have contracted COVID-19. This illness is what we're up against, not against each other. Each one of us has a very important role to play in keeping us all safe, caring for one another, and using this challenge to bring out our best humanity. So thank you, and I'll now turn it over to Secretary-Designee Andrea Palm. Andrea?
Thank you, Governor. Good afternoon, everyone, and thanks for joining us again today. The COVID-19 pandemic is challenging all of us, and I see evidence of Wisconsin rising to meet that challenge every single day. Our neighbors volunteering with Meals on Wheels or packaging food to be delivered from food banks. Grandkids reaching out to nursing home residents with music concerts over their speakerphone. Restaurants donating food to hospital staff, and manufacturers participating in the governor's PPE donation and buyback program. And now that the governor has put out this call for volunteers to help staff hospitals and clinics across our state, I know this will be one more way that Wisconsin rises to the challenge of COVID-19. The first step in confronting a challenge, in trying to fix a difficult problem, is understanding it. This means digging into the data and continuing to be transparent, which is why we have added data on COVID-19 cases and deaths broken down by race and ethnicity. Consistent with what other parts of the country are seeing, these numbers show us that the pandemic is disproportionately affecting the African American community in Wisconsin. To be clear, COVID-19 can infect any individual, And at the same time, it also has a more significant effect on communities that have been underserved by inequitable access to health care. COVID-19 is making more visible the health disparities that already exist in our state, and we must work to end these disparities. This will be long-term work for us at DHS, but we are committed to doing this work so that every Wisconsinite has an opportunity to thrive. Our partners at the Department of Workforce Development are also working to assist Wisconsinites who have applied for unemployment insurance benefits. In the last 3 weeks, DWD has seen 296,000 initial unemployment claims. Unemployment can also result in a loss of health insurance. However, just like you are eligible to apply for unemployment after a job loss, the loss of employer-based health insurance means you are eligible to apply for health insurance elsewhere. Depending on your income, you may be eligible for Badger Care, and you can find more information on that state insurance program and its eligibility requirements at access.wisconsin.gov. If you're not eligible for Badger Care, you have a 60-day window from your job loss to enroll in a new health insurance plan through healthcare.gov. You can get free help to explore your options by calling 211 or connecting with an enrollment assister at coveringwi.org. I encourage you to look into your options because taking care of your health is more important than ever. Another challenge facing many Wisconsinites is access to affordable food. Through funding from the federal Families First Coronavirus Response Act, we are going to be able to help with that. Any food share household in Wisconsin not currently at the maximum benefit for their family size will see an increase in their benefits. These increases will be available to 215,000 food share households on their Quest cards on April 12th and then again on April 26th. DHS also continues to track cases in Wisconsin, and so here is our update on where we stand today. We have 20 active labs that are running COVID-19 tests in Wisconsin with a daily lab capacity of 3,756 tests. In fact, we have more capacity for testing than the number of tests done by providers. To address this, we've expanded our testing guidance and will continue to communicate with providers to further expand testing. We have 33,225 negative tests, which is an increase of 1,801 negative results over yesterday. We have one county reporting a case for the first time, and that's Polk County. We now have 3,068 confirmed cases in the state of Wisconsin, which is an increase of 183 Wisconsinites over yesterday. Our number of COVID-19 hospitalizations is 904, which is an increase of 61 over yesterday. This means that 29% of people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total deaths have now reached 128, with 2 counties reporting deaths for the first time. Those are Brown and Grant counties. This is a challenging time in Wisconsin and across our country, and we do honor the memories of all those who have passed on, and we grieve for those of you who are experiencing this loss. But I know Wisconsin will continue to rise to the challenge and stay safer at home. We will continue to practice physical distancing to flatten the curve, and we will continue to support each other to reach out and connect in creative ways. Thank you all for what you are doing to keep yourselves and all of Wisconsin healthy and safe. I think now we're going to hear from Secretary Mary Kolar of the Wisconsin Veterans Affairs.
Okay, thank you, Governor Evers and Secretary Designee Palm. Thank you for the opportunity to update everyone on particularly our veterans' homes. I greatly appreciate the entire DHS team and their hard work and expertise and guidance as we do all we can to prevent the spread of COVID-19. And I especially thank the governor for his leadership during this challenging time. Again, an update on our COVID-19 activities at our Wisconsin veterans' homes and throughout the Wisconsin Department of Veterans Affairs. Providing a safe and healthy environment for our veterans and the residents who live at our homes and our staff is our top priority. As Secretary of the Wisconsin Department of Veterans Affairs, I'm responsible for overseeing various veterans programs and services throughout the state. Overseeing the state's 3 24-hour skilled nursing facilities for veterans and their families is foremost among them. You may have a family member residing at one of our homes. We are responsible for the care and safety of about 680 veterans and nearly 1,000 staff, including medical professionals, at our homes located in Chippewa Falls, King, and Union Grove. At this time, we have no cases of COVID-19 at our Wisconsin veterans' homes. This includes both staff and members. We continue to follow the recommendations of the Centers for Disease Control and the Wisconsin Department of Health Services and carry out our normal protocols to help prevent the spread of the disease. Over the past few weeks, we have taken several steps to help prevent the spread of COVID-19 in the Wisconsin veterans' homes, including restricting visitors and volunteers from visiting facilities, except in end-of-life situations. Actively screening every single person who is entering our facilities, including staff, for COVID-19 symptoms. The screening includes a temperature check. Daily screening all members for COVID-19 symptoms. Canceled all large group activities and communal dining and focused on smaller unit and individual activities. Educating all members and staff to practice social distancing. Renewed emphasis on routine environmental cleaning. And we have stopped drop-off donations, but there is one exception to this donations rule. With the most recent guidance of the Center for Disease Control, we are now accepting donations of handmade cotton masks for use by those who live in our homes. The CDC has said that residents need to cover their mouth and nose when staff are in their rooms, and we believe cotton masks will help make that easier for them. Please do not mistake this as a request for personal protective equipment or PPE, such as N95 masks, as we currently have PPE available for staff. When it comes to PPE, we are following CDC recommendations, learning from what has happened in other states, and have the appropriate measures in place to request more in the case of an outbreak. Also know that when we do receive homemade cotton masks, we will be taking the appropriate steps to sanitize them before we give them to our residents. Before I conclude, I'd like to briefly touch on 2 other items that may be helpful to you and the veterans who you may know. First, if you're looking for information about any of our programs, benefits, or services, the staff at our Veterans Benefits and Resource Center can help. As we follow Safer at Home guidelines, you can reach a customer service representative through the online Chat Now feature located in the bottom corner of the screen at www.wisvets.com. We also encourage use of www.mywisvets.com for learning about eligibility for Wisconsin veterans benefits. Second, if you are a veteran in need or you know a veteran who's experiencing housing, substance use, or mental health issues, we want you to know that there are many resources available to you or them. We understand this is a really tough time for everyone, but particularly those with underlying mental health issues. If you go to the WDVA website, wisvets.com, and click on the COVID-19 link, you will find a broad array of resources available to help. please, if you need it, utilize the federal VA's crisis hotline, 1-800-273-8255. Other resources include Vets for Warriors, who provides 24/7 confidential peer support to any veteran, service member, or family member. Military OneSource stands ready to assist military members. Anyone can call 211 and get connected to local services. Each and every one of us can help by calling, sending a text, or an email, and perform what we call in the military a buddy check for a friend who may be struggling. The WDVA also has staff standing by who can help. Our Veterans Outreach and Recovery Program coordinators are located throughout the state and are able to connect veterans with community resources such as mental health services, emergency shelter, food and housing assistance, access to health care, financial assistance, and more. We can then provide the case management that veterans need to move forward in a healthy way. The VORP coordinator's contact information is on our website, or you can simply use the Chat Now feature I mentioned, and our customer service reps will put you in contact with the right person. Wisconsin has a strong veterans community of which I am proud to be a part. I know that we all will continue to work together and support one another as we get through this challenging time. Thank you.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please one question per reporter per media outlet. And we'll begin today with Scott Bauer from the Associated Press. Scott?
Hi. Thank you, everyone, for doing this call. A two-part question. One, Governor, could you react to the Republicans saying they're coming in next week to take up COVID legislation? Have you agreed to what they're proposing or seen it? And two, related to that, Secretary Palm, Republican senators today, two senators have accused you and the department of stoking fear, and they claim that lawmakers were told the stay-at-home order may be extended for 6 months. Could you react to those comments as well?
And I'll just begin about the legislation, and we continue to have conversations with legislators, and we're hopeful that next week we'll see a bipartisan solution that helps us kind of bridge the gaps that are existing in the federal legislation. So I'm looking forward to it. I haven't seen the details of what they're proposing, and it's always important to wait for the bills to be put out there so we can actually see and react to it. But I'm hopeful, and hopefully we will reach a good conclusion.
So Scott, this is Andrea. I would say since the beginning of this outbreak, we have worked to be as transparent as we can about the facts on the ground here in Wisconsin. And so our goal is to make sure that Wisconsinites understand the outbreak here in context with what's going on around the country and around the world, so that we can make the best decisions and work together to protect the people of this state. As it relates to the safer at home order, I think until we have a vaccine, until we have medical intervention, we are going, as the governor said, to have to very actively manage this outbreak. And Safer at Home is the current tool that we are using. We used a variety of tools before we got to Safer at Home. We assume we will use a variety of tools as we manage this in a more active way with moving forward. I certainly have not put a specific time frame on when we would pull back from Safer at Home, because as we have said every day in this media briefing, we are following our data very closely. We are trying to understand what it means for the extent to which we are flattening the curve. We are looking at other parts of the country and other places around the world to understand how they have managed, how they have altered their interventions as their peaks have happened, as their surges have happened, as they have moved through this outbreak, so that we can make the best decisions in a real-time way to help protect the people of this state.
Thank you, Scott. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for taking my call. I just want to go back to the governor's decision that had been talked about a couple weeks ago to buy 10,000 ventilators, and I'm just wondering if we could get an update on how that's going, where we are in that process, and also how that 10,000 number was decided upon specifically.
This is Andrea. I'm happy to take that. I think it's important for folks to know that this was the 10,000 was our portion of a multi-state effort to buy ventilators, which fell through. So we do not have 10,000 ventilators currently on order, but we have very actively been pursuing other opportunities to purchase ventilators, and most recently have been working with a company to purchase around 1,500 ventilators in anticipation of continuing to need to have access to these kinds of medical supplies. As we have discussed throughout this outbreak, our goal is to plan for the worst and do everything we can to prevent that from happening. And so we do continue to look for needed medical supplies for PPE. We do continue to plan for potential surge and are working on surge capacity with local jurisdictions around the state. We've stood up isolation facilities. We are bulking up our contact tracing and our testing capabilities. But again, our goal is to be ready for anything and do our very best to make sure it doesn't happen.
Thank you, Maddie. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly? Molly Beck?
Sorry about that. Thanks for taking this call. Governor, two Republican senators are suggesting in statements today that it's unfair that public employees haven't been subject to pay cuts as private workers have and also experienced layoffs. Is that something that you would consider doing to help the state's finances?
I'm sorry, the question is, I mean, we have people, almost all state employees are working. If they work, we expect that they'll be paid. It's pretty simple.
We've been watching a live news conference with Governor Tony Evers and other Wisconsin leaders. Minnesota Governor Tim Walz is now giving his update via phone. We'll listen in live.
Operator, and thank you to everybody for joining us for a slightly downsized daily media call today. Governor Walz is not on today's call as he observes Good Friday with his family. Our lineup will start with Minnesota Commissioner of Health Jan Malcolm making some brief opening comments and talking about some of our latest case numbers. Following that, we will open it up for questions from reporters on the line. We do have Infectious Disease Division Director Chris Eiersman and State Health Economist Stefan Gildemeister on the line for questions that you might have. So following that, we'll open it up now with Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Thanks. We appreciate having a chance to spend more time with you today on some of the health-related questions. I will begin just with the same kind of data update that we've been doing in recent days. Globally and nationally, the context is that the global total of cases as of early this morning was over 1.6 million cases and 96,000 deaths. In the United States, we are reporting just over 466,000 confirmed cases. 162,000 about of those cases is in the state of New York, a little over 87,000 in New York City alone. The United States is reporting just under 17,000 deaths, over 5,000 of those in New York City alone. Here in Minnesota, we have now a total of 1,336 confirmed cases in our state, which is up 94 from yesterday's total. But again, the rate of growth continues to be fairly stable. So we're going up at about the same pace each day, with the double-in time still around 8 days. So, unfortunately, sadly, again, we confirmed 7 more COVID-19 deaths yesterday for a new total of 57 in the state. 2 of those individuals were in their 60s, 3 in their 80s, and 2 in their 90s. 5 of the 7 were residents of long-term care facilities. On the hospitalization front, there are currently 143 patients currently in the hospital as of today. That's actually 2 less than yesterday. 1 additional person was admitted to ICU. 3 were discharged from a non-ICU level of care. Also, as of today, 732 patients have been released from isolation. I would like to just make another comment about the mask situation. Just as we've been saying in recent days, there are lots of questions about the increasing CDC guidance that wearing masks in public is a helpful strategy to help slow the spread of the disease. And as we've been saying, if individual Minnesotans have or can make homemade cloth face masks for themselves, for their families, and for others, to please consider doing that. We have a lot of folks out there who are creative and good sewers. If people are in a position where they can help make homemade cloth face masks and donate them, some particularly good places to donate them would be to your local child care facilities, nursing homes, or other community organizations. As we've talked about, masks really can be helpful in protecting us from each other. As we've been saying, if I wear a mask, I'm not doing that to protect myself. I'm doing that to protect you from me in case I have the infection and don't know it. Because if I know it, hopefully I'm confined to my home. But I can wear a mask to protect you from the potential that I may be an asymptomatic spreader of the disease, and you can protect me by you wearing a mask for the same reason. So we've been trying to get that message out there, that the masks are helpful for preventing spread in that way. They are not medical grade equipment. They are not personal protective equipment. And we really need to preserve those medical grade masks and equipment for direct patient care. So that's why we're emphasizing so much that there are a lot of us who work in public settings or who go to public settings for whom wearing masks is very helpful to prevent the spread of illness. But we really, really need to conserve and reserve that higher grade medical grade masks and equipment for those who are doing direct hands-on patient care. A lot of folks, even in the healthcare system, are providing important services but not doing direct patient care. So back to the plea for people to make masks and donate them. If you have that skill, that time, that ability, be a wonderful thing to do. And please, but if you're thinking of donating it to a specific facility, it's a good idea to call ahead to be sure the facility can accept your donation at this time. But certainly if they can't, others can. So for more information on how to sew cloth face masks, for pattern ideas and materials that are recommended, please go to the MDH website. There is a face mask icon on the right-hand side of the page. The Centers for Disease Control and Prevention website also has this information. Most fabric stores have online ordering and curbside pickup options, so it's possible to order the materials that you would need for such a project, but still maintain social distancing guidelines. That concludes my comments for the day. I will see, and as Mike said, Chris Erzman and Stefan Gildemeister are both on the line with me. I think folks are aware that we've been rolling out increasing amounts of information about the analytics that we've been doing, the modeling with the School of Public Health. So Stefan is on to help answer questions about that, and Chris, of course, with her great depth of knowledge about what's going on with the epidemic in Minnesota. So, Chris, unless you have any other comments you want to make at this time, we can open it right to questions.
Nope, that sounds great.
All right, operator, we're ready to take questions.
Thank you, presenters. And at this time, you will need to press star 1 on your telephone keypad if you would like to ask a question. And to withdraw your question, press the pound key. Please stand by while we compile the Q&A roster.
A health leaders update on the COVID-19 response. Minnesota Governor Tim Walz was not on that call, as they said he is observing Good Friday with his family today. And you heard the encouragement there from Commissioner Jan Malcolm to wear those masks when you are in public, not to protect yourself, but to protect others in case you may have the virus and be asymptomatic. We will continue to track developments this afternoon and bring you updates as they happen on the WDIO website and mobile app, and we'll have the latest on WDIO News at 5. Thank you for joining us.
This has been a WDIO News special report.